Hi, everybody. Welcome back to the Blueberry Pediatric podcast. Today, I am joined by two phenomenal doctors that work for Blueberry. I'm going to have them introduce themselves in 1 second, but the topic today is one of great interest to so many parents. We get so many calls about constipation and all the gastrointestinal, the GI tract issues that our kids have over and over and over, and we need answers to. So why don't you both introduce yourselves? We'll start with Sari, Dr. Kay, and then we'll go from there.
Hi guys, I'm Sari Kay. I am a pediatrician and board certified pediatric gastroenterologist.
Yay, I'm so glad you're here and that you've chosen to help people with this. I'm Rachel Tayez. I'm a pediatrician. I'm in Minnesota where I do my Blueberry work, and I have been a general pediatrician for over 20 years.
Thank you. All right. So we're getting two great perspectives in the general pediatrician office, where most of us take our kids regularly for issues, and also from a subspecialist. Dr. Kay takes care of all the GI stuff, does procedures, and this is like what she's dedicated her life to. So we get all the goods out of this. All right. So why is this important? Up to 30% of children experience constipation at some point, and it's the most common reasons for pediatric visits and GI referrals. Chronic constipation can impact school attendance, behavior, appetite, and family stress. I am guilty of that as well. And GI complaints are among the top reasons parents seek telehealth visits. All right, so let's jump into it. Let's talk about what normal pooping is, so we can go into the abnormal pooping. So, what is what is normal pooping?
I'd probably describe it as bowel movements that are passed easily, that are soft, that basically are things that you don't necessarily always need to talk about. The patient usually is passing a bowel movement every day, every other day, and it's coming out without really much effort or much discussion on the part of the patient or the parent, and really something that happens routinely.
All right. Would you say there's a certain color? You talked about a lot of consistency. I want to make sure we hit all the qualities.
Totally. I want to, color is always a concern for parents. And I think the most important thing and takeaway is that color can vary based on diet and medications and infections and other things going on in the GI tract. The most common thing to change your stool color is food. Kids eat a lot of variety of food colors, and everything from frosting to Fruit Loops to some common like lollipops and other things that kids are eating often can change the stool color. But the most colors are totally fine. Colors can vary from brown to kind of orangey to light brown to green, and all of those are normal. The most concerning ones would be white, black, and really bright red.
So I know we're talking about normal still, but really, really common question is about those white stools. People get very concerned when their kid's stool is white. And I think we see it a lot more when they're ill, when they have cold symptoms. Can you talk about that a little bit?
Yeah, that's what I see also. White stool can be concerning if it's a very small infant. An older child, it's typically seen if they are drinking too much milk, and commonly when they have an infection. And those I would say are pretty normal. I typically recommend monitoring closely and decreasing the amount of milk if there is an excessive amount. White stool otherwise is usually not as concerning in an older child.
I think one thing I've seen happen is that it'll happen once and parents freak out, and it has to happen. And so usually it's not going to happen multiple times in an older child, but it for anything to really be concerning, like one time does not help us really figure out what's going on in a lot of cases. So it would have to be really repeated over and over. And so we get a lot of questions about babies or like really young kids, toddlers, on how much they should be pooping. So there are kids who poop every day, multiple times, and there's others who do it every other day. And like, what would you say is the normal span of days to go without pooping? And when would you get concerned?
Well, I think it varies mostly on the age of the patient. Breastfed infants who are exclusively breastfed can go up to 10 to 14 days without a bowel movement, and actually that's normal. They're absorbing all of the breast milk nutrition and the things that typically we would watch out for in those situations is the consistency of the stool and how the baby's doing. If the baby's happy and well appearing and the stool comes out eventually soft and mushy, then that's totally normal. And you could say that weekly bowel movements in a 3-month-old breastfed baby would be normal. In an older child, typically we like to see daily bowel movements. Every other day is also considered on the normal spectrum, but the consistency of the stool is also really important to consider. A child who's having daily bowel movements that are hard, painful, large, they're going to be considered constipated, similarly to the ones that are passing bowel movements every 3 to 4 days. Similarly, if a patient passes a bowel movement every 2 to 3 days and they're soft and easily passed, then typically we don't consider them as constipated.
Okay, great. I think that's really helpful. And so, do you want to give like a little primer on like the GI tract and the order of how things pass, how things like why a stool is runny, why it's compacted?
Sure. Yeah, I think it's helpful to understand how that works, and then you can understand how stool consistency gets the way it is, and we turn constipated. We eat food, it goes from our esophagus into the stomach where it gets churned up. And then once it hits the small intestine, the food nutrition gets absorbed. And pretty much all of our absorption of nutrition gets done in the small intestine. That takes between 4 and 8 hours, for example, typically. And then it gets into the large intestine. And the large intestine is pretty much a holding tank. Doesn't do much digestion. It pretty much is where the food and waste goes before it leaves the body. And the job of the colon is to take the water out. And the speed of how the stool is going through is going to impact the consistency of the stool. If a patient is having very slow transit or is not evacuating their bowels very frequently, the colon will continue to draw the water out, and then therefore the bowel movements get very hard and dry. Patients who pass bowel movements very quickly, for example, often don't have as much time to absorb the water. It can be very runny, and the days that go by between having bowel movements results in a very large amount of water getting taken out of the colon and therefore hard. And
So, all right, that's a great segue into constipation and what it is exactly and how it presents. So, let's go through that. You want to start, Rachel?
So I think for me, a lot of the times constipation surprises us. The number one thing I think we see is a child who has belly pain and the family can't figure out why. And so that's one of the first things that pediatricians are going to look at is and ask about is, where's the pain, but what are their bowel movements like? And then oftentimes we discover, maybe the parent hasn't asked about it because they're not thinking about it. Or if they're a younger kid, they're right on top of it, have been keeping track of it. But I think once you get to school age, nobody's really talking about it anymore and it's not thinking of it as number one on their list. Parents tend to think belly pain, something else kind of more scary. But the majority of time, it's not scary. I think for me, it also becomes way more common, just throwing this in there for parents during school age, because nobody wants to poop at school, right? And then people, they start withholding and then it makes it harder to go. It gets painful, then they don't want to go at home either.
I think that's totally spot on. And one of the things to sort of talk about also would be what are the common reasons and times for kids to start with constipation issues? Because at different ages, it's very common to like, oh yeah, that's a very classic time to start with constipation issues. Infants and little kids oftentimes have issues that start around solid introduction. Their food is different. They may not be taking in quite as much liquids. Similarly, those toddler toilet training age comes sometimes with a lot of anxiety and fear around pooping.
Mhm.
Toilet training is a very common time to start with withholding and constipation. And then, just like you said, Rachel, the school age children, pooping in school is not a favorite thing for pretty much anyone, and in public in general. I see a lot of kids who give me a lot of reasons why the bathroom at school is not fun. And I remember when I was a kid, it was not my favorite place. And they withhold and wait till they get home. And sometimes, if you're withholding for so long, you kind of lose the feeling to go. And then the next day goes by. So the urge comes commonly after eating, and you're often eating at school, and you
Mhm.
withhold, and then you have have that cycle kind of start.
I think it's so interesting that kids feel that way at such an early age and like that it's private, that it's embarrassing. And it's a shame they do, but it really doesn't go away in adulthood either a lot often. I worked with a nurse actually. I will never forget this. And I don't know how we got to talk. It's probably a late night. We were up at 3 a.m., I'm sure. And she was telling me about the far and aways, which is what she called the toilets that were far and away, which is where you go to poop. And wherever I will like walk, wherever I go, and I identify that's a far and away, that's a far and away.
That is amazing. I love that.
Right? So
Yes,
good.
so good.
Okay, so let's go. So we talked about like what it is, how kids present, and
Mhm.
now should we get into the recommendations when that happens?
I think the number one thing, and Rachel, you can attest to this, is asking about bowel movements for like the first complaint, so you can get on top of it as soon as possible, because the longer it goes, the harder it is to treat, and the more um, symptomatic the patient is going to be, and
Mhm.
the more, you know, stressed everybody in the family is going to be, which is not easy either. The
The more
other point,
intervention then. Sorry.
totally. The other point I was going to make is that I always recommend asking details, because I cannot tell you how many people I say, "Oh, are they pooping? Is it regular?" And they say it's normal. And I always like to say, your normal is not my normal. And what you think is normal may not be normal. And then, in fact, you ask them more details. What does it look like? How often is it coming? And things
Mhm.
like that. And it's not normal.
And
And
this is both
so,
parents and kids who are defining it like that.
Right.
totally, totally. And they
Well,
don't know what normal.
I think a lot of kids don't want to look in the toilet. I would say teenagers are big, like not curious at all about what's happening there, right?
They want to get
Yeah,
in and out.
Yeah.
100%. It's
I,
normal, or I don't know.
I mean, we're all so used to talking about poop right all the time, right? Just it's a normal word for us. I kind of wonder, Lyndsey, when you're talking about, why is it a thing that people, that kids already know to avoid? I wonder, a lot of people when they like change a kid's diapers, they're like, ooh, stinky, stinky, stinky. I wonder if like really early on, we're kind of labeling pooping as, you know, other than the book Everybody Poops, we're labeling pooping as like a bad thing.
There's like also something that's so like animalistic about it because even toddlers in diapers who are too little to like make sense of the world, they hide to go poop. Like it's a private thing that they don't want to
Hmm.
share with it. My 3-year-old makes me door close, light and fan go on, and no one's allowed to come in until she's ready.
I love that. I always say, normalize pooping as much as you can in your house, because I also think some of it is like, if everybody poops, then it makes it easier to go. And I know in my house, when my kids were toilet training, it was like, door open, this is what happens. Are you ready to do it? Kind of thing. And making it not as much of a I know, Lyndsey, yours likes to be private, but I do think like making it totally normalized, because some
Yeah.
people are more almost on the embarrassed side, and it smells like Rachel was saying, all the things, but everybody poops.
Absolutely. And that's part of what you helped me with my kid deal was teaching them it's the behavioral side of it. It's not necessarily the physiological side of things and the physical. body doing things the kids voluntarily withholding and teaching them the behavioral aspects of things for how to get through it. All right, so you want to actually break those down? Like, does that make sense to be able to go through how to handle it?
Totally. I think one thing before we go there is to try to understand the reasons for constipation. The vast majority of the time, it's something that is related to behavior. We call it functional constipation, which essentially means that there isn't another reason, like anatomic reason or neurologic reason or electrolytes are off or some other chronic disease that may be related to constipation or have constipation as a symptom. Those things can be sometimes factors that contribute to constipation and of course aren't related to behavioral withholding, for example, like we were just talking about. But the ones that don't have red flags, which is what we really look for when we're trying to discuss constipation and what we're going to do to treat it, we need to just rule out any sort of other reason why you would have constipation.
Okay, got it. All right, so didn't you want to go into now how we handle it?
Yes. So patients who have constipation, which we don't feel are necessarily related to something else, I kind of tackle it with 3 strategies. And the strategies that I usually use are depending on how the patient is presenting. Diet is obviously really important. Diet high in fiber, fruits and vegetables is what I usually recommend. Drinking a lot of water is also another recommendation. I try not to make too many recommendations with regards to diet aside from those because I don't like to put too many restrictions on kids when we're talking about eating. They're oftentimes pretty picky to begin with, and focusing on increasing our fruits and vegetables, water is important. The other thing that is often a common culprit is milk. So trying to make sure that we're drinking a limited amount, 12 to 16 ounces, maybe a day, depending on age. But sometimes I get patients that are drinking 30, 60 of milk a day. And again, some simple changes can sometimes be all that you need to treat it. The other 2 components pretty much, again, have to do with the age of the patient. Toilet training behaviors and toileting behaviors are really important, trying to get patients to sit on the toilet. Timed toilet sitting is important because a lot of times patients aren't really sitting on the toilet regularly. Their bodies aren't feeling like they need to go regularly. So getting them to sit on the toilet after a meal, which is the most common time to poop, is what I would recommend. I usually recommend sitting without phones, books, iPads. Really got to kind of get your brain back into pooping. And also putting like a stool or a squatty potty or something under your feet, as that really helps the positioning to allow for easy stool passage. The other things I like to recommend in the bathroom help with the abdominal pressure that you need to poop. And I often recommend things like blowing bubbles or playing an instrument or something where they are basically blowing and that helps get that pressure, because oftentimes kids are sitting on the toilet and they're actually like withholding, or they don't want to let that bowel movement out. And with the position and the timing, then that pressure, you will enhance the stooling. And then lastly, medications are used. And again, I think it depends on what exactly is happening with the patient. If they're having hard bowel movements, the preferred treatment regimens include things that are going to soften the stools. Infrequent stools or stools that are not complete, we usually use stimulants. And I would say I typically try to avoid any sort of enemas or suppositories or things like that.
Mm-hmm.
They often cause a lot of anxiety and drama, and it's not always going to help with the long-term management. It may relieve in the moment, but the strategies I like to talk about really help with getting a more regular and routine bowel movement, and that is just going to help with like the bottom stool.
That's really helpful. And the medications that you're talking about, which are those?
Yeah, so my typical go-to is Miralax. Miralax is super easy to use. It is a powder. You can put it in literally any liquid, from milk, water, juice, even coffee. It doesn't taste like anything. You often can hide it if kids don't want to take medications. And the nice thing about it is that you can adjust it so that your child's having a soft bowel movement. And I always kind of say there's no overdosing on Miralax. You're just going to get a soft stool, and that's what we're going for. Um, Patients sometimes don't respond well, don't like it, don't want it, and there are other options. We usually go to milk of magnesia, and occasionally something like lactulose. We actually have some prescription medications also now for kids for constipation, but that's typically something once we've failed everything else.
I was just going to add that you're sorry as an expert, but you're the pediatricians and the family practice doctors, like those are we're very comfortable with all of those too. Um, so just so families know that they can start with, their regular doctor before going to Sari for her expertise.
Yeah.
Definitely. The other thing I like to point out too is that I find that patients try the medication like once, or they do like a tiny bit, and then they say it doesn't work. And the truth is that, especially if you've been dealing with this for a long time, this isn't like a one and done kind of treatment. You need to be aggressive. Sometimes, if it's really significant constipation, we have to do like what I call clean out and basically flush out all the stool, almost like you're doing a colonoscopy prep, and really start from fresh after that. And that requires multiple doses of Miralax, usually, sometimes using stimulants like X-Lax as well, Senna, to try to really flush the system, because using like a little drip of Miralax on a lot of hard stool is not going to be effective, and doesn't really mean that it didn't work. It just probably means you need more.
I would say, in addition to that, like not working, like not using enough, as you said, but not taking it long enough. So it's not really an episode of constipation unless you're on something like vacation, right? When your diets change and your kid gets kind of messed up for a few days. If it's a chronic problem, I mean, you really have to take it for a couple of months to give your gut a chance to relearn, right? Is there a typical time you generally recommend that people stay on the treatment?
That's such a great question, because I think in addition to like only trying a teaspoon once and saying it doesn't work, constipation treatment is long. When I was in training, we used to say, as long as it took to get here, it's going to take to get back. And sometimes that's years. The treatment strategy really requires very strict and structured habits with the softeners, with the sitting, and it can typically take 3, 6, 9 months or more. I always like to reassure my patients that the medications are safe, very minimal side effects typically. You can be on them long term, even though the bottle just says, after 1 week, 2 weeks, talk to your doctor. It's not going to be fixed that quickly. I usually say it's definitely going to be better. And just like somebody who has high blood pressure and you take your medication and now you have low blood pressure, you're great. You still need your medication to keep it that way. And that's how constipation is too. Until you've really made those diet modifications, behavioral modifications, constipation is just going to come back if you take that Miralax or whatever medication you're using away.
Really helpful. The one thing that stands out to me in the advice that I've received from you before also is the consistency that you're going for. Because, like you said, can't overdose really, like you'll get loose stools.
Hmm.
And it's hard to know like titrating up or down in the amount you give, the powder that you're going to put into the fluid. You also have to give the right amount of fluid with it. So it's good to be guided as you're doing this. But I always remember you're aiming for soft serve ice cream consistency.
Yep, exactly. Soft serve ice cream, mashed potatoes, and peanut butter. My three classic things to think about, and when we're thinking about stool consistency.
Awesome. All right.
The
Any
other thing about stool consistency, I'll just mention is especially like easy for parents to go to if you look up the Bristol stools chart. It's a standardized stool chart with pictures of poop, and basically. For those who don't look at their stool or don't know or have a hard time describing it, because it's sometimes embarrassing for them, looking at the chart, and they can kind of point to which one it looks like. Number 4 on the chart, if you go take a look, is really the perfect poop. And 4 or 5, there's soft, smooth logs, smooth bananas, soft serve ice cream, all the
Smooth
things.
bananas.
Yeah.
Thank you for that.
It is really helpful. I've had like just tell me which one it looks like. You don't have to do anymore. And just for people watching, it's Bristol, Bristol, right?
Yeah.
All right. So common GI questions asked from parents. Let's run through them in what's it called? A lightning round.
Rapid fire lightning round.
All right. Actually, I don't know if we're going to be able to do lightning, but let's go with why does my child always say their stomach hurts? Tough one to just pinhole here. But most likely reason is
constipation.
Constipation.
I think the other main one is, aside from like surely organic things, is anxiety.
Anxiety, yeah.
Definitely.
Yeah, so that's a real thing. Anxiety can make a kid's stomach hurt. Yep.
And it's real pain. I think that's important for people to know. It's real pain to them. I think like we stigmatize mental health enough that then it seems like the pain is sort of a semi made up pain, but it's pretty real.
Definitely. And it's, important to understand it's related to disordered brain gut interaction. And I think that with that terminology, you can understand that your brain and your gut are super closely connected. We have actually 10 times as many neurotransmitters in our gut than in our brain, and they're all the same. So there's just dysregulation and perceived pain because of that.
Any feelings on prebiotics and probiotics? I know it's a bit controversial in terms of the literature.
Yeah, I think it is. I mean, they haven't been studied well, or when they've been studied, it's been kind of iffy whether or not they help with constipation or diarrhea on the other end. But they aren't harmful to try. So, I mean, trying a couple times if a parent really wants to, you can see if that has an effect, but it's probably not going to be the only thing to manage your child's constipation. All of the tools that Sari mentioned are going to be more important there.
Great. All right. Any like real red flags that stand out that when parents would really should worry?
Yeah, certainly red flags are always what I'm listening for when I'm listening to the stories. Things like weight loss, waking up in the middle of the night because of pain, accidents that we didn't really go into the accidents part of constipation, but a teenager having accidents of poop is really a red flag. What else? Sorry. Blood in the stool can sometimes be a red flag. Vomiting and severe pain that it can be related to constipation, but the pain that's making the child sit up from fun activities and missing preferred activities, I would say, is sometimes a red flag as well.
Yeah. All right. Anything else I missed?
I think the takeaway is to treat early and to treat aggressively and be consistent. That is really important. And of course, talk to your pediatrician first. They do know a lot about constipation.
Yeah.
And poop.
And talk to your kid regularly. family,
Start early.
family poop talk.
And ask what normal is, because it's
Yeah.
There we go.
All right. This has been great. Thank you both so much for joining. And thank you to our listeners for joining the Blueberry Pediatric podcast. If you like what you hear and you're learning, please like and subscribe. Thank you.
Thanks for having us.
Thank you.
Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.